still, I mean, Fugl-Meyer change of 1 point is on daily life not kind of impacting for the patients, I would say. So what do you think, so you think that the patient should be selected better in a way to stratify them more for your therapy? Or it's just a fact of intensity, as you mentioned? Or what is your guess to enhance basically the effects of this training?
That's right. It's both is important. We need a high intensity of training to get a better improvement or to make the training more efficient. And it's also right to find the responders. Everyone is different with respect to biometric aspects, with respect to the kind of lesion, and also with respect to the technology which might be applied in the different labs and clinics. And we have to find these properties and parameters which have the highest chance to get the biggest improvement. We did some analysis. We found some covariates. We're still, it's not published yet, but what I've shown already is one covariate is the severity of the lesion. Yeah? We see that those who have a more severe lesion can improve more by using a robotic training. There might be other covariates like times since stroke, maybe gender, probably not, and the different kind of technologies being applied, age of the subjects and so on. And we have to find responders, but also the non-responders so that we can make a better prognosis which kind of training has the best efficiency.
The robotics training, or could it be also an effect if you have somebody who takes so much time, like a physio, or you take another passive orthosis where they can achieve the same training time? Would you expect the same gain, or is it something specific to, you showed also nicely the combination with virtual reality, so they have these games to play basically to keep motivation up, or so do you think it's very specific to robotics, or it's just a question of how much you do and you are motivated? So if you achieve it with a therapist or with a passive device where you get some benefits, or with the robots, at the end it will be the same.
Yeah. The great advantage of robots are first that you can apply them to the human subjects in a very intensive way. And second, you can add cues which you usually do not have when you do conventional training, like a multimodal, visual, auditory, motivating cue and environment. And that has a big chance, which is new. And of course, there are other ways how to motivate the patients. Yeah? The personal contact with therapists is very, very important. They can also be very motivational. And maybe we need to do an extra study to compare this, but it's difficult. Yeah? We get so many different conditions and it takes so much time. With this large variability among the different patients, it's very difficult to finish all these studies.
I'll just follow up with that. So we're doing some studies with rehabilitationists to see if different patterns of muscle defects, muscle coordination defects could be addressed through different ways, and that's one very sort of mechanistic aspect of rehabilitation that robotics can more specifically target if we can figure out what the differences are. But the other thing is that I really like this adapted tango type of rehabilitation because it's a whole person type of rehabilitation, and it's important not to lose that. The patients, they like coming in, they like interacting with people. We're having them do a very cognitively challenging, engaging task. It's also relevant that they're learning a skill. They're not being rehabilitated, right? They're learning to dance. So I think that type of motivation, interaction, and everything needs to be layered on top of any type of technology that we would use to not treat people as robots themselves.
So Robert, when was Fugl-Meyer introduced? What's the time of Fugl-Meyer? You know the years of that?
It's quite old. It's from the 70s.
So I think one of the bottleneck of all what we do is how we evaluate outcomes with technologies. Because, I mean, for instance, Lena raised, I mean, I may have divergence from what Lena said, but we all recognize that there are individual features, okay? And on one hand, we have this individual behavior. On the other hand, we have reducing the results, in order to be convincing and do clinical study, we have 6 numbers, 6 grades that are, and the problem for that is that there has not been an effort to develop standards because it's too difficult. But to me, the real challenge and the real question is how we are actually creating a system of outcome evaluation that is actually fitting the development of technologies. We are not, my feeling is that we are not there yet at all.
Yeah, I agree. The Fuggemeier score is the worst score, but there's no better score. And people are still using it in studies with stroke patients. It's very important. It's, as you said, I think, it's a impairment-based score only. It has actually nothing to do with daily life. We need to score daily life aspects if you want to improve daily life of the patients. But that becomes very complicated because it gets less quantitative and more descriptive. And there are no quantitative scores to score how do you feel today. And there's a lot to do, and we work on that.
So I suggest we take some more questions from the audience. Yes, in the back.
I think I can speak loudly. Thanks a lot for your great talks. I was wondering whether you had insight into the kind of variability that is actually helpful for training and rehabilitation. We saw some examples that noise could actually, what is called noise, but it's not maybe really noise, could help learning. And in other case, whether perturbation may actually be, like right now you're assisting the patient, for example, with robots. Would you think about, rather than just assisting, adding source of variability along dimensions that are forcing them to explore more of the structure that you want actually them to learn? Adding in perturbation, how much work have you collectively been doing along those lines?
You know, this is a question that probably would take days to answer. I mean, and maybe not, we are not able to answer. First is that the first one is what we call noise, right? And there is an operational way, engineering, which is noise is whatever is not signal. So whatever doesn't carry information that is relevant to a particular thing that you're studying. So it's a very arbitrary cutoff line, right? So the idea is that noise is a fluctuations or is a variability over some kind of mean values under the assumption, say, that the muscle want to generate a certain level of forces and instead it generates something that fluctuates. So it's a, but the whole point is that yes, there is a noise. The biological systems are inherently noisy, and there are a lot of development of science that see that there are some good values in different ways to noise. The other question that you raised is the issue of whether, for instance, in rehabilitation, whether you want to do assistive or resistive interventions. Meaning, if you have a person that is with a stroke, okay, with a little ability to make a movement of the arm, right? You can actually have a robot performing the movement, right? So in this way, the rationale for that is that you give the person a sensation about the outcome, the motion of the arm, and by doing that, you may hope to, trigger or somewhat facilitate the ability to. And the point is that somebody will say, yes, I give you a sensation that your arm has moved to a target, but this sensation is not consistent with the command, because your command is not appropriate. And so that may actually not be a good thing. And so then you have the other approach that is, if I have difficulty to move 10 centimeters, I make it even harder so that in order to do whatever I do, eventually I will become able to. So it's the logic of when you do exercise at the gym, you exercise the muscles that you're weaker on and so on. So these are, I think this is a debate that has obtained pros and cons. I don't think there is an answer that is really universal on these things. I think is still to a large extent a trial and error that the therapist is tailoring on the patients that they have.
Maybe I have a follow-up question about this. A big topic in reinforcement learning is this trade-off between exploration and exploitation. Do everyone have a bit the same strategy of how to do that? And this noise could possibly help to do exploration. So I was wondering how patient-specific this notion is, and if you could help guiding this right balance between the two.
Well, again, these are things that are not codified in precise terms, but there is a clear, for instance, we have this system, this body-machine interface, where you learn to control an object by moving your upper body and your shoulder, and it happens that by doing that, you can actually, your system may explore, may find solutions to do a movement that has never been tried before. And so by virtue of this, you can also get maladaptive responses. So you have to be careful. I have something, I mean, Lina has raised this issue of individual responses, okay? And if I may, I have a lot of agreement with that, but I have also profound disagreement with that, in the sense that when we say that there are individual responses, it's a little bit like religion. It's like yes, there are individual responses, but you know, if in science you want to try to understand what is the basis for those individual responses. So simply saying, so it's a typical case when you do an experiment that you get 10 subjects and you have a hypothesis, right? You try the hypothesis, and at the end you find the so-called mixed bag answer, which is, you know, you have 10 subjects, 6 subjects do one thing, and 2 subjects do something else, another 2 do another thing as well. And so you cannot actually collapse everything into an answer, yes or no. And then the problem is that you can come out and publishing a paper saying, yeah, we have individual responses, subject A does that, subject B. But really what you would like to do, you would like to understand what is the basis for this difference. And that is not that different from, so optimal control, optimization, I also have misgivings with that. But misgivings is that in reality, optimal control, you have to ask the question, what optimal with respect to what? Because, you know, there is something which is called the cost function that you want to minimize in optimal control. And in theory, given any response, you can find a cost function that gives you that response. You can do what is called inversal optimal control. So the question is that, are we, I mean, this is a debate that was in science at the time of quantum mechanics. Are we thinking that people are just random, or are we simply not understanding what is the basis of individual behavior that is not just being individual?
So, yeah, you can't just look at the randomness as just being randomness. And this is what I have an issue with just talking about noise, right? Because most of the noise is going to be irrelevant. You really want to look at task-relevant variations. And so the variations have a particular structure to them, and that is the thing that is common across all of the individuals that we look at, is that they have a very specific structure that they use for moving their leg in a particular way. And so I don't force each person to have the same exact muscle activation pattern or to average them, but I know that I can find a unit of action that is common about everybody who can move their leg in this particular way. And then we can look at the control of that and also look at sort of a low-dimensional structure in the control, and depending on whether you care about energy optimization more than I do, that's going to affect what the pattern is. But the idea is that that pattern isn't random. It's very structured, and we allow for parameter variations within that structure. So the structure is the thing that's common, and that allows us to not allow for any kind of random variation, but only task-relevant ones. That each person has the same task to solve, but they might solve it in a slightly different way. If we move up to that higher level, then you can actually start to compare people. This person has 4 modules. This one lacks a module for moving the arm to the left. That kind of a thing. So it has to be, you're right, you're absolutely right. It can't be just any kind of
But when I
variation.
say, but you raise the issue, when you say signal-dependent noise, you introduce actually the signal into the game. So what I'm saying, noise is I see it in a very practical manner. Suppose that you want people making movement of the hand on a horizontal plane, okay? I can do movement like this, or I can do movement like this, right? And if I want to convince somebody to make movement like this and not like this or anything in the middle, one thing that turned out, I believe, to be effective is to teach you with a cursor on a screen and to make the cursor becoming jittery as much as I move from this position. So I'm not telling you, put your elbow up. I'm just let you figure out what is that you should make to make the cursor less jittery. And all what we have is that there is a kind of an antipathy of the brain for controlling jittery things. And so without giving an instruction, you can implicitly use the tendency to escape a kind of a confused signal as a way to encode the instruction implicitly. And I'm not saying that this is the only way to do things, but in this very strict sense, I call it noise because it's something that obfuscates the information that you try to achieve by moving.
Well, so that's the noise out at the task level. But if you want to look at muscles, we've done some studies that aren't published yet saying, how are all the different ways that you can coordinate your muscles? If you just sort of randomly vary the coordination of muscles, it may be very difficult to go from one useful pattern to another useful pattern. Most of the patterns are not useful, and in actually trying to reduce muscle coactivation is not that easy for us to do in our searches because that landscape is very, very bumpy. There are a lot of local minima, so that's why I think it can't just be random noise, but it has to be more directed.
I suggest we take one last question, and a rapid question and a rapid answer. Any? If not, let me ask it. Maybe I like this notion of motor accent a lot because indeed you should almost filter your subject that they have all the same motor accent, or you should train them to get this accent. So how do you plan to handle this in the future? Could you do that? That you identify at first what's the motor accent of the person and try to select him that way?
Yeah. So the motor accent. So the unit is the phoneme, right? So we see this in language, and that you have the same sort of continuous space that gets chunked into different, let's say, vowel sounds for different languages, and so you end up with people from one language. They can speak, Japanese really well, but they have difficulty with Chinese. So we have to really think about that. What kind of prior history of training does somebody have? What kind of tasks are they already able to discriminate, whereas somebody else may not have that ability? And then you can focus on sort of that type of chunking in space, of what space they can't reach and which space is merged and needs to be separated, or in the case of stroke.
Very good. So wonderful. I suggest a big round of applause for all the speakers, and it's now coffee break.